Hi, my name is Jan Johnson, and I have been a nurse for 15 years. When reviewing the AACN Advanced Level 3 domain competencies, it was easy to see why nurses play a critical role in advocating, developing, and implementing policies that impact population health. Although I'm not considered an advanced level nurse yet, I believe I do have some experience on both sides of the competencies. As an entry-level nurse, my peers and I noticed that we were having an increase in readmissions for some of our patients with heart failure. We brought it up in our unit shared governance, and then it went up to our hospital shared governance, and then it ended up in the quality department. So as a result, a new heart failure book was created to educate the patients during their hospital stay, and they took it home so that they could reference it when needed. We also created a new hospital position for a heart failure coordinator. They would follow our heart failure patients closely while in the hospital, and then upon discharge, she would call the patients at home and make sure that they were taking their medications properly, and asked if they had any questions so she could help them right then and there. We did see a decrease in heart failure readmission rates, probably by 25% within the first 6 months. So that's what we did in the entry level. Entry-level nurses identify the need for change, and they evaluate the effectiveness of the advocacy actions, like the example that I just provided. The advanced level nurse develops a collaborative approach to address the population's healthcare needs. I was a stroke coordinator at a previous hospital. It was in a very small elderly community, and I noticed that they were waiting too late to come in to get treatment. And because those patients waited too long to come in, they were suffering severe permanent disabilities. I contacted many of my sister hospitals within my hospital's division and kind of asked them if they were dealing with the same issues, and they did share the same concerns. I brought this concern to one of my stroke committee meetings with hospital leaders and some of our ER physicians, and we all decided that we needed to reach out to key stakeholders in the community to discuss this. We involved Hillsborough County Rescue and Fire to get their opinion and to discuss any barriers that we all had. It was discovered that our community wasn't even fully aware of the symptoms to look out for, or the possibility the stroke is an actual medical emergency. And because it was in an elderly community, a lot of the residents don't even drive anymore. So that was another barrier that we found. And talking to some of the residents out in the community, they were saying that, they didn't want to call 911 for something as little as weakness or dizziness. Because of those identified barriers, we decided that we needed to get out into the community and teach them the signs and symptoms of stroke, and emphasize the fact that it is a medical emergency and they truly need to get to the hospital ASAP. We did this at local health fairs and community events such as golf tournaments, because that was very popular where we were. And also we reached out to the churches as well. The education was well received by the community, and we started to see an increase in utilization of Altaplace at our hospital, as well as a decrease in the amount of physical impairments due to the stroke. Even though that's a very small piece of what an advanced level nurse can do, it still made a big impact on our community. When reviewing the topic of disasters and public health emergencies, I immediately thought of COVID-19. I was a manager of a med-surg unit at the very start of COVID, and I remember having to implement effective infection control measures and the proper use of PPE as directed by the CDC. When there is a public health emergency in the future, I plan to use what I have learned in this class as an advanced level nurse to contribute to system level planning and decision making. I would like to begin this journey by increasing my involvement in advocating for a health care program or initiative within my own community. I would like to focus on the lack of access to healthy foods due to the economic status of many of our community members. My idea is a community garden, and I know I'll have to most likely lean on hospital leaders, city council members, leaders within the community, and I'm not really sure the steps to take yet, but it looks like that we will all be learning that in the second phase of this course. So I look forward to that.